Okay friends, today we are going to discuss about the respiratory physiology from the starting point. Now, when you study respiratory physiology, it has two zones. One is the conducting zone and one is the respiratory zone. The conducting zone contains your nostrils, pharynx, larynx, trachea, main bronchus, bronchioles and terminal bronchioles. Now friends, terminal bronchioles, I will pay attention to terminal bronchioles mainly. Terminal bronchioles, when there is disease of terminal bronchioles, you will listen on auscultation the sound of wheezing sound. Wheezing sound will be heard on auscultation if the problem or if the disease is involving the terminal bronchioles. And the main example or the important example of disease of terminal bronchioles are or is bronchial asthma, which is a kind of COPD. So bronchial asthma targets the terminal bronchioles. Keep in mind this. Now there are respiratory zone. So respiratory zone contains respiratory bronchioles, then alveoli duct, alveolar sacs, and all the echines. So this is conducting zone and respiratory zones. Conducting zone is also called anatomical dead space because no exchange of gas occurs in this area. So conducting zone and respiratory zone. Now moving forward, we will now pay attention to lung volumes, all the lung volumes. Okay, nothing hard. Now see, now I am breathing or now I am inspiring and expiring air. I am in the phase of tidal volume. This is the tidal volume. This is the tidal volume, which is not for a normal person is 500 ml, like this. This is tidal volume. Now, if I am breathing normally, now this is inspiratory reserve volume. I am inspiring more than my tidal volume, more than my normal inspiration. I am exerting force in inspiration. Now this extra is inspiratory reserve volume, which is normally 3000 ml. Now see students, now I am excreting or expiring more air, which is expiratory reserve volume. Again, now this expiratory reserve volume more than normal tidal volume, I am expiring more volume, which is expiratory reserve volume, which is normally 1200 ml. Now I am doing this. Now I am taking more air also and expiring more air also. So I am doing inspiratory reserve volume also using, and I am using expiratory reserve volume also. So whole this I am now doing whole volume, which is called vital capacity of the lung. This is the vital capacity, which includes inspiratory reserve volume, your tidal volume, and expiratory reserve volume. Okay. After expiratory reserve volume is expired from your lungs, like this. Now you're thinking no air will be there in the lungs, but you're wrong, friends. There is residual volume always there present in the lungs, which is 1200 ml for a normal 1200 to normally 1200 to normally to 1500 ml. This is normal for an adult. So residual volume, you cannot excrete or expire the residual volume from your lungs. Okay, why it is needed, I will tell you later. So this is all about the volumes. Now after volumes, the main entities of the lungs are the volumes and the capacities. Capacities are derived from the volume. So what are the capacities? Now one is inspiratory capacity. Inspiratory capacity is the sum of inspired reserve volume plus the tidal volume. Again, this is tidal volume. Now this is inspiratory capacity, IRV plus the tidal volume. Okay, now again tidal volume. Now, again, expiratory reserve volume plus the tidal volume, which is the expiratory capacity. Tidal volume plus the expiratory reserve volume, which is the expiratory capacity. Okay. Now, one of the most important thing, which is the functional residual capacity. Now, functional residual capacity is the sum of expired reserve volume plus the residual volume. Okay. FRC, very important in diseases, in diagnosing diseases like COPD and all that. So expiratory reserve volume plus the residual volume is the functional residual capacity of your lung. And now all the IRV plus TV plus ERV plus residual volume is the total lung capacity, which is 6 liters normally. Okay, it normally comes to 6 liters. 6 liters. So nothing hard, friends. This is the tidal volume. Inspiratory reserve volume. Expiratory reserve volume. So IRV plus TV, inspiration capacity. TV plus ERV, expiratory capacity, and ERV plus residual volume is the functional residual capacity of your lung. Now, you have heard, friends, about the spirometry. Now, what is spirometry? Spirometry is a technique or is an instrument by which we calculate all these lung capacities for a patient or for a person. Okay. Now, one thing to remember, spirometry does not calculate the residual volume. Residual volume is not calculated. This residual volume is not calculated by spirometry. For calculating residual volume, other methods are there. So spirometry doesn't detect the residual volume. It detects all other volumes except the residual volume. Okay, friends, please like, comment, share my videos and subscribe. Thank you.